We're working on preventing fatty liver. Fatty liver is increasing in our world because of what we eat, the way we live. And you wouldn't think that'd be a problem, but it turns out the fat is toxic to the liver cells. Causes inflammation. Inflammation causes scarring. Scarring is cirrhosis. So we used to have liver damage from viruses and alcohol. Those aren't gone, but the big increase now is fatty liver from Western diets and the way we live. It's the most rapidly rising cause for needing a liver transplantation. We had been working for many years on the way cells talk to each other using little molecules called prostaglandins. And we made a discovery that these molecules can be taken up by cells. And we knocked out the gene in a mouse. We didn't know what we'd find. Amongst the things we found was that you cannot give that mouse fatty liver, no matter how hard you try. So we thought this might be a good target for drug development. So even though I'm not really trained as a liver scientist, I'm a physician by training, the need is so great that we went after that. So we've been targeting that molecule as a way to treat fatty liver in people. The goal is to minimize the ability of the liver to make all this extra fat and cause this toxicity, and keep people from developing dead livers that either take their life or require a big operation, a liver transplantation. So we went to the National Institutes of Health with a grant to develop drugs to do this, and they turned us away. They didn't fund us. And we submitted a grant to the Harrington, and here we are. And they're filling a gap for us. So they've put some money into the lab, but more importantly, they've brought tremendous expertise to the table. So they've given us the use of a medicinal chemist who is absolutely world class. They've supplied funds to have a chemical synthesis company make variants in drugs, and we're testing them, making really, really good progress. If I had had to pay for that chemist and that chemical synthesis out of my grants or our laboratory, we couldn't have done it. I'm a physician. I take care of patients with this disorder, and it's very troublesome. It affects people of all ages. We have a pediatric program at our medical center that focuses on fatty liver and the damage to the liver in children and adolescents. And it's a growing problem, in part because of the increase in dietary habits and obesity in children and adolescents, and that affects the liver, it causes fatty liver, and the damage. So we have to fix this. We have to fix this in adults. We have to fix this in kids.